Hi everyone. So today I am just going to take us through a little foam roller session. So you're just going to need some floor space and your foam roller. So all of the things today can be done with a long or short foam roller. So our focus today is releasing through the upper part of the spine and rib cage. We are going to be doing some extension work back on the rib cage there and across the shoulders, and also some soft tissue release around the back of the shoulders and around the side of the body. So we'll talk you through all of those exercises. The main focus and reason that I instruct clients and patients to do this kind of release work on the roller is generally because pretty much all of us day to day, our activities of daily living, our tasks, our work, we're always holding a posture where our arms are coming forwards, we're looking in front of us, we're looking down. And often, we're holding our arms out here. So this just tends to start pulling us slowly and slowly more and more forwards. We get weaker through here, we tend to round through here, and we get really tight through the front of the chest there. So it's just all contributing to this not ideal posture, and these things cause little strains and sprains throughout the body, postural strains they're called. So you can get tension through the upper traps, which then causes headaches. You can get pain through the ribs, all of these sorts of things. Also, when this part of our spine is not functioning or moving as well as the other parts of the spine, we tend to overcompensate through our neck or through our lower back. So this middle part of our spine is the stiffest part of your spine, because you have your rib cage, your ribs attaching to the spinal column. So it means that there's just that little bit of extra bony contact, so you don't have as much rotation, side bending, things like that through that area of the spine. It's also where we naturally curve forward. So if we naturally curve forwards and then we're holding ourselves forwards all day, every day, then we are going to slowly start adopting that posture just naturally, because that's where we're holding ourselves. That's where we get strong. So doing this release work just encourages movement in the opposite direction to really help open you out, feel that release, feel what it's like to allow the body to elongate and stretch back up tall as well. Now, if some of you are not very experienced with the foam roller, or if you're a little bit extra tight and tender, or tend to pull up a little bit sore from treatments and things like that, let's just be mindful of that. If the roller is at any time feeling a little bit too intense, you'll know straight away if it's like, oh, that's a bit too much within the first sort of 10 seconds. You can always get a towel and fold it over, and then that just creates a little bit of extra cushioning over that roller for you. So then it's not as intense of a feeling, particularly on the bony bits of your spine. Okay, so we're going to get started here. So this is great for anyone that's a desk worker, or just, a mum doing dishes, things like that. If you're driving long hours, lots of manual labourers have arms in front, arms above head all the time, shoulders rounding forward. So it's pretty much applicable to everyone to do this kind of work. All right, so I'm going to have our roller just behind your bottom there. Now, I'm just going to draw attention to my rib cage here. So just above where my lower spine attaches is the bottom of my rib cage. So we're going to lean back onto the roller with the roller across that lower part of the rib cage. So feet firmly planted on the ground for support. The longer rollers are a little bit easier to control here, because you don't have to sort of stretch your shoulders as much if you've got that shorter roller. And then we're going to bring our hands just to the back of your head. Okay? And now from there, we're just going to ease our way into a little bit of extension. And then slowly coming back up. We're not coming up into a big sit-up, but we will use the abs a little bit just to come back to your neutral position. So just that long spine. Reaching back and coming forward. Inhale, reach back. Exhale, lifting up. Now from here, we're just going to work that little section of your spine. I go for about 8 reps on each level. So just really encouraging that movement in the opposite direction that we don't normally allow that part of our spine to do. Just decompressing through there, thanking it for all the hard work it does for us all day, every day. And then from there, so I've done my 8, I'm going to just slide the roller up. Think about a roller width up is how far up you're going. So now I'm just at the bottom of my shoulder blades. Hands behind the head, interlace the fingers, and we arch back and lift up. Take this in whatever range you feel comfortable with. You might want to start with just a little rock back, and then as you feel the body accepting the movement, then you can slowly increase. So I know a lot of people have their foam rollers at home, but they don't quite know what they should be doing with them. So just thought I'd do a few little videos on things that we can really utilize this tool really well for. And with a bit of consistency, you'll find that you're managing those little niggles and discomforts and stiffnesses a lot better. Okay, so then from there, we're going up a little bit more. Now I should mention, particularly with this upper part, if you've got a really slippery t-shirt or top on, sometimes that roller does try to run away from you. So just be mindful of that. So now I've gone to just across the center of my shoulder blade. So just the top couple of inches of my shoulders are above the roller, hands behind the head to support. And this is only for people that don't get any dizziness with any neck movements, and also as long as you're feeling comfortable with this neck extension. So don't go into it if you're feeling any pain. And then we reach back there. So no pain in the neck. I mean, you might get a little bit of discomfort under your spine because that's where we're working through here. So it's normal to feel some trigger points, some little bits of discomfort, but if you're feeling any sharp pain or any pain that's making you feel really apprehensive, then just back off from that movement or pop that towel on, or maybe just this movement's a little bit too intense for you today. So now we're just working into extension through that very top part of the spine there, just supporting the head and neck as we reach back. Let's go 2 more. And last one. So you want to spend no more than a minute on each section of that spine there. And now we're just going to move down a little bit here. So we're kind of across that bottom to middle part of your shoulder blades again. And I just cross, you can cross like this. And then I just lean to the side a little bit, and then I'm getting right into the back of those shoulder blade muscles there. So you might find there's some little trigger points through there that you can feel released. Play around with your angles. It might be a little bit closer to center or a little bit more around to the side of the body there, but I'm sure you'll feel some little spots to release. And see, I'm not really putting too much weight. I think a lot of people that get shown foam roller exercises, and also if you look them up on YouTube and things like that, and you're a complete beginner to it, people go a bit gung-ho on their videos on how to release muscles with the roller. They get you doing all these funny balancing tricks and putting all of your weight, you know, lifting the legs up so I've just got the shoulder touching and my whole body weight's going through there. Just think you don't need that much pressure to release gently through there. And once you start getting better at it, you can start advancing and doing those slightly more intense release exercises. And then I'm just going to roll across and do the opposite side there. So again, if you've got that little bit more of a slippery t-shirt there, that's going to be a bit more challenging because that roller does tend to try and creep away. And yeah, if you've got that shorter roller as well, so just move the roller around accordingly. Shorter rollers are great space savers, but you can really do so much more with a longer one. So I've always had my longer one. Alrighty, now from there, We're going to come around onto our side. Now, I'll warn you first that this can get a little bit intense. So we were just working muscles at the back of our shoulder blade here, those rotator cuff muscles. Those muscles are really important for holding our shoulders in really nice posture and alignment. So by releasing those, we allow them to activate a bit better so they can hold us nice and open through that part of the chest. Now, what I'm going to get us to work on is just a little bit through attachment point of your lats at that lateral border of the scapula, but also there's a little muscle in here, Serratus anterior. So that attaches from that lateral border of the shoulder onto a few of these ribs here at the side. Now, I tend to find that if people have a lot of stiffness through that upper back, because they've been bringing their shoulders forwards like that, this muscle tends to pull on that shoulder blade and brings it forwards and tightens up because of that position that we get really strong in just from our postural day-to-day activities. And it's a really big culprit for preventing us to open up through our spine. So I find it's really nice to release through here because it's pretty much impossible to stretch because of its attachment points on the skeleton. So the only real way you can get release through it is to do myofascial trigger point release on a roller or to see a therapist to release through there. So this is a really handy one. Again, we're not going to put too much weight through because it's a little bit intense. So we're just going to have our legs bent to the side now. And all you're going to do is just pop that side of the rib cage. So think upper chest just to the bottom of the armpit. And then I just wiggle. It's not nice, it's not pretty, but it gets the job done. And from here, you can still get into a little bit more of those rotator cuff muscles in the back. And as you come forwards a little bit more, that's when you're going to get a bit more into that serratus anterior I was telling you about. Okay, so just have a little feel. With each area for soft tissue release, I just want you to focus no more than 60 seconds on each area. So if you watched a YouTube video on this or an instructional video and someone was going to, side plank and then get all that weight through, it's pretty intense just putting this part of your body weight and having everything on the ground. So I find that this tends, particularly for really small muscles, it tends to be enough. You don't have to put your whole body weight through to get that same effect. And think, if you see a therapist, like a lot of us are very strong, 100% I'm a bully as an osteo, but I'm not putting my whole body weight through one tiny area ever. So just food for thought. All right, let's come over onto that second side. Coming around, flipping those legs around. All right, so feet bent and finding that little spot and then just wriggling through that side body. Oh, much tighter on this side, on this left side. So obviously I have a little bit of extra homework to do to try and even out. I found if you find a little knotty spot or a real tender point, you can just kind of pause leaning into that area, make the movement really small. But if you're finding like it's just really nice going along those muscle fibers, then just keep doing that. But if you find it's kind of like a sweet pain, we describe it as like a good pain, not a oh, I shouldn't be doing that pain, but it might refer around to the back, it might refer up into the head. If you find a spot that refers somewhere else, that's completely normal. All parts of our body tend to have different patterns of referred pain. So it's good actually if you find something around here and it sends a bit of a headache up, because then a lot of people don't realize they can get pain in the rib cage around the thoracic spine and it can refer all the way up to the head. So you might have found something that someone has missed before when trying to treat your headaches. Alrighty, so again, you can lean back a little bit and get into that rotator cuff. Always remembering, support your neck if it starts straining at all. I tend to also, when I'm on the side like this, look down to the ground, and that takes a bit of that strain out of the neck from holding it upright to the side. Obviously, I want to try and look at you guys a bit more, and then coming a bit more forwards into, yeah, it's not glamorous. You kind of feel like a bit of a caterpillar just wriggling around on the ground there. But I tell you, you do this a couple times a week, or even just, you know, this is probably my go-to if I've been doing any editing videos, things like that, and I'm sitting long periods. This will be my go-to before bed or in the morning, things like that. This will be my recovery for that. Alrighty, so that's us all done for today. I hope that was helpful, and I hope that explained a few things for you, and it's given you some food for thought on what to do with the roller to help with that upper part of your spine. Okay, thanks so much for joining. Bye.